to come here and give my thoughts as someone living with type 1 diabetes. I thought it best to try and relate to a story, so I've typed up a little something. So, January 11th, 1922. This was the day that Leonard Thompson received his first insulin injection and became the first person to be treated with insulin for type 1 diabetes. Access to insulin saved Leonard from near certain death. Much has changed since insulin's discovery in the 1920s, when scientists Banting and Best isolated it from the pancreas of dogs. It was a feat that persuaded its discoverers to license the process free of charge to approved manufacturers. Insulin was seen as a gift to humankind rather than an opportunity for commercial profit. But, as we've just heard, this insulin market makes $20.8 billion. But millions of people in both poor and resource-rich countries are unable to claim this gift. I am fortunate and I have been able to access this gift. Wrapped in its vial, insulin every day continues to extend my life. How is it that almost 100 years since its discovery, some have to beg, scavenge, and plead, and more, just to be given the privilege of its use? At least half of the estimated 100 million people with diabetes worldwide who need insulin do not have access to it, and people are dying. Access. Such a simple word. But without it comes completely preventable deaths and puts strain on national healthcare systems and creates immense economic losses and pain, a human burden that money cannot replace. Yes, I am fortunate to sit here in front of you healthy and with my insulin pump duly attached. But coming from the Caribbean, I have seen and faced limited access myself. From the days with no more of my insulin available on the entire island and having to bring it in from other neighboring countries such as Jamaica, to having to fly to the US every 3 months just to be able to access an insulin pump. In poor countries where insulin is not available, children do not survive a year after diagnosis. I have lost one too many friends like this. My friends in sub-Saharan Africa actually send me regular Facebook messages begging them to send them insulin, as they don't know where their next dose will come from. The pain and trauma this brings to myself, but can you imagine their families, friends, their communities? That husband that is no longer able to support his child and family. Price and affordability. For some parents in parts of Africa and Asia, as sad as it is, having a child die from diabetes can actually be a relief. They no longer have to foot the bill of insulin, which means they can pay to send their other children to school and to support their whole families. I have friends alive today, even though their doctors told their families, don't bother. It's best you let her die. She will be too expensive to take care of, and you don't need that burden and expense covering a shadow over your family. For the last 2 years, whilst fighting for insurance, I personally have had to pay about $9,000 a year for my diabetes. Access to insulin, yes, it is vital. But what about all the other costs to ensure a quality of life for people with diabetes? Yes, it is essential to survive, but is surviving all we're doing? From the person who has intermittent access, a steady supply is vital. Last year, I lost a friend who struggled with access all her. From the person with access as the has access but doesn't have the resource, they are limited by funding. A lower patient price is vital. From the person with access and the resources, a quality of life without looking as patient X is vital. For people living with diabetes, access is the first step, and a quality of life free from the burdens and struggles is the goal. So as a patient, where do I think the focus should be? With regards to the insulin market, the global market should match the healthcare outlines put forth, in that insulin is an essential medicine and everyone should have it. It will benefit the country more, and if more people are healthy. It is not, as we just heard, much as an inhibition as before, because the patents are soon to be extinct. We therefore need more manufacturers, creating more competition out there worldwide, getting insulin into the hands who don't already have. The price of insulin are the deaths and pains experienced by people living with diabetes, their families, communities, and countries, not what goes into the pockets of the manufacturers. It is the year 2016. People are dying, and we're nowhere near finished. Thank you.